Is Medicare for All bound to go the way of Republicans' failed promise to repeal and replace? Here with me now to discuss, it's Tim Carney, the Washington Examiner commentary editor and American Enterprise Institute visiting fellow. Tim, welcome back to the show.
Thanks, Kennedy.
So what is the worst case scenario with Medicare for All?
The worst case scenario is that the government, because they are paying our bills with taxpayers' money, gets in the business of telling us how to be healthy. The fact is, Kennedy, every donut you eat, you're now paying for the health care costs. Under Medicare for All, under single payer, then I will be paying for it. And I, or Kamala Harris, then gets to tell you not to eat it. I'm worried about them saying, well, 3 kids is fine, but any more than that is a little excessive because that's more healthcare people. When government is that involved in the most intimate aspect of the economy, which is healthcare, then you're going to have an increase in government control over our daily lives. And that's my main concern.
That is absolutely it. And that's why you saw Michelle Obama's well-intended food policies take effect in our nation's public schools, hand in hand at the same time as her husband's Health Care Act was passed in this country. And that's exactly right. And taxpayers should be going, if I am paying for it, why should I be funding the bad choices of individuals? And that can become extremely problematic. It's also interesting politically because Democrats, I guess those who want to be president, have chosen this issue as a winning one for them.
Yep.
Tell me about that.
Well, it's the idea that the primaries are about playing to the base of the party. And the base of the party is liberal, and that they, if you remember, as a Democratic primaries in 2008, it was Hillary and Barack hashing over who was going to provide the better sort of government-supported, government-regulated health care system. And now they're doing this. They're just turning it up to 11. That the play is to the base to show that you are a real hardcore progressive. The issue that's at the intersection of economics and sort of cultural issues is this single-payer thing, that this is where they can go ahead and whether Bernie Sanders doesn't have as much cred on the culture wars or Kamala Harris doesn't have as much cred on the sort of left-wing economic agenda, here they both sort of reach into a spot that fits both of those brands. It's the intersection of the cultural and the economic left-wing thing to win the base in the primaries.
I understand that. And oftentimes the argument that they make is, look at the rest of the industrialized world. They all have socialized medicine. Look at Sweden. Look at all of Scandinavia. Look at Western Europe. But you make a much more important point, which is the rest of the world looks to us. How?
Well, they count on us for medical innovation because markets is where innovation gets created. And I'm a firm believer that we need a safety net for healthcare for sick people. Jesus made that very clear in the Bible with the Good Samaritan story. But there should be a market with a safety net, and the market is what drives the innovation. So these other countries where it's all one big safety net, there's not the money pouring in that guides innovation. And if you say, oh, well, the government can fund it, I mean, I don't think anybody has a lot of confidence in the ability for the government to pick better than the market does. The private sector is what drives innovation, and so far the rest of the world is sort of piggybacking on American innovation. So if then we step onto the same boat as Canada or onto the universal health care, all government provided, God forbid, like England, then I think you'll see the medical innovation dry up, and then that won't be good for the health of anyone.
No, and you'll see generations will suffer the consequences of cratering positions that are no longer held by the best and brightest. You want the best researchers, you want the best doctors, you want the best caregivers. How do you do that? You incentivize them to come into medical fields by maybe at some point making a good living. It's crazy how that happens.
Yeah, so but I ultimately have to say, though, when I look at government-run health care, not the Medicare for All, but the England version, again, we get back to the basic moral issue. You look at the boy, Charlie Gard, who died, the government would not let his parents try to keep him alive for a few more months. That's the real problem. It's the moral problem when the government is in charge of our health care.
And you will see more and more stories like that in this country. Tim Carney, thank you so much.